Welcome to Johnson County Community College. So my name is Michelle Riley, and I'm a registered dietitian and assistant professor in the Department of Hospitality Management. And we're very excited to have you guys here for our Cook Right, Eat Right presentation for this month. We have several great presenters, and then we will have some food for you to sample. So I'm now going to introduce Dr. Deborah Sullivan, who is chair of the Department of Nutrition and Dietetics at the University of Kansas Medical Center. Thank you.
Thank you, Michelle. And it's also my pleasure to welcome everyone tonight. And we're very excited to be offering these programs. And this is a joint effort with Johnson County Community College, the University of Kansas Health System, and the University of Kansas Medical Center, and specifically my department, the Department of Dietetics and Nutrition. So it's my pleasure to introduce our experts for this evening on cancer, and they are Dr. Elizabeth Wulff-Burchfield, and she's in the Division of Medical Oncology at the University of Kansas Health System, and Dr. Jill Hamilton-Reeves, who has a PhD in nutrition science and is also a registered dietitian, and they work together clinically but also in research on diet and cancer issues. So welcome, doctors.
Great, thank you. All right, so we are going to run this a little bit more like a talk show kind of thing. So we have a format. We'd really like you to ask your questions because I think if you're here, you're probably wanting to learn, and if you have a burning question, we'll give you a chance every topic that we go through. So what we're going to do is we're going to talk about some of the new guidelines that were just released this spring for tips for cancer prevention and also tips for cancer survival and treatment. And how these guidelines come about is there's an organization called the American Institute for Cancer Research, and they scour all the evidence that's available and then have a panel of experts weigh in on how we should frame these things, and then we have guidelines that we can talk about. Now, all guidelines are meant for big populations and maybe not for individuals. And so you might be thinking, as you hear the guideline, well, does that apply to me? What does that mean? And so that is what we are here for. I'll present the guideline, and then Dr. Wulff-Burchfield, our medical oncologist, can give some anecdotal conversation points about that, and then we'll ask you for your thoughts, comments, and questions. Sound like a plan? All right, great. So to start out, I think it's helpful to have some framework about what really is the power of our choices, our behavioral choices each day. And data would suggest that half of cancers could be preventable by using sunscreen, avoiding smoking, eating a healthy diet, staying physically active, and keeping a healthy weight. All those things actually sound kind of hard. But if you put them all together, that can have a pretty dramatic impact. One of the things that I run into clinically, and maybe you can speak to this, is when I work with patients that have just unfortunately heard the worst, that they have a cancer diagnosis and they're really trying to wrap their mind around it, sometimes they go through some negative self-talk and some shame about the choices that they made through their life. And that's really not very helpful from kind of picking up and going forward and taking care of themselves. So I don't know, have you ever had that kind of reaction or questions?
Oh yes, and I'll be honest with you, that to me as a medical oncologist is heartbreaking, because in truth, one can never know which exact case of cancer was preventable and which it was not. And so I agree, I don't think that's very productive, and I think while on one level it provides a sort of strange reassurance to try and come up with a reason that a person may have been diagnosed with cancer, just so that to reduce the randomness of the world down to something a little bit more palatable, we can never know on an individual patient level. And so, but I do think when I do talk to my patients about behavior change and lifestyle change going forward, I really hope that it will help not only to improve their chance of cancer recurrence, they kind of decrease the chance of that, decrease the chance that they could get another cancer, and also be a great example for all the people they love in their life who, like all of us, may have a 50%, may be able to prevent 50% of cancers, and therefore set a better example so that they can hopefully have better results.
Yeah, and so many cancer diagnoses now are treatable, and so we have a growing population of cancer survivors. And my grandparents, 3 of the 4 of them had cancer diagnoses, and 2 of them that initially fought the primary tumor and did really well, they had an extra 20 years. And one of the great lessons that I learned as their grandchild was how they lived their life to the fullest with all kinds of adventure, and a lot of that was the quality of life. And so adapting healthy lifestyles, even at a time where it might be a crisis, is kind of a window of opportunity. So some of our studies, we work with gentlemen that have prostate cancer, and we're trying to help them avoid weight gain, and they feel better than they felt in a really long time. So, so that's kind of a message of hope, and that was like I planted you there. I'm so glad that you're ready to talk. What's your name, sir?
John.
John, okay.
Just to feed my curiosity,
yeah.
In regards to the in changing of lifestyle,
yeah.
how much that has affected, will affect, or has affected the cancer rates in this country. And I realize this is not your focus here, but my father was a smoker.
Yeah.
Okay, and he smoked throughout his entire life, never had any problem. Okay, but the culture today has changed radically from a smoking culture to a non-smoking culture.
Mm-hmm.
And I don't know the numbers, but I'm assuming that a much smaller number of Americans smoke compared with what they did in my father's generation.
Yeah.
So I'm curious, in that change, how much of an effect has that had on lung cancer in this country?
Well, John, that was a great question. So I'm just going to summarize what John said for the people that are listening to the recording. So John was giving a story of his dad who had cancer. No, grandfather. Sorry.
No, he didn't have cancer.
Oh, okay, but he was a smoker. Okay, a smoker. But just recognizing that smoking is much less common now. So interestingly, I just talked to the medical students yesterday about this. I was teaching, and there's some slides that show the data of the decreasing rates of cancer incidence in our smoking-related cancers. So it's not just lung cancer, but it's also bladder cancer that and for tobacco use, head and neck, esophageal. Mm-hmm. And so those cancers, the rates are going down, and particularly in men. And we didn't get the same peak of incidence in women, and there's some thought that it's because there were fewer women smokers, and their uptake was later than when men started smoking and it became so common. Do you have anything else to add to that?
Well, I think what you're getting at is the idea that not everyone who smokes tobacco gets a smoking-related cancer. Is that part of what your question is?
Not necessarily. He
okay.
was the exception,
yes.
I believe, rather than the rule type of thing. And he tried to quit.
Mm-hmm.
As you know, it's very hard when you have a nicotine addiction, but never was successful. But I was just curious, because what we're talking about here is making lifestyle changes to improve or lower the cancer rates.
Yeah.
And I was just curious, since we have gone through a period of probably about 40 years of reduction in the use of tobacco, what are we seeing?
Yes, and we are seeing a decrease in the incidence of some smoking-related cancers, particularly the form of lung cancer most closely associated with cigarette smoking, which is small cell lung cancer, has been decreasing in incidence right on par with the trend of decreased cigarette smoking in the country.
But on the flip side, our population is growing in size, so the rates of obesity have been increasing, and the 12 to 13 cancers that are associated with obesity, the incidence of those cancers is going up. And so one of the cancer prevention messages is to be a healthy weight. One way to look at that is your body mass index, and we have some numbers, 18.5 to 24.9. But really, if you go to the doctor's office, a lot of times they'll let you know if you're within that normal range. Even maybe more importantly is waist circumference, so where you store extra body fat. It's a higher risk to have extra body fat in the midsection than it is in the thighs. And then, to know that we have a healthy weight for ourselves, so to know yourself individually and to be a healthy weight that you feel good at is really important. And so those are kind of the simple messages. Do you have any anecdotal comments about this?
Well, sometimes because we do talk about global wellness when I meet patients who are diagnosed with cancer, this does often come up. And a lot of my patients are really doing their homework in really unprecedented way and are reading about some of this data. And one of the questions that comes up for me with my patients is, well, I know that I'm overweight. I know that we're embarking on chemotherapy together. Why don't we just, is this a good time to try and go on a diet? And a lot of the time we do talk about, especially if we have a chemotherapy course that is limited by a certain window of time, we're often talking more about maintenance, just because trying to actively lose weight during a period of time when so many different bodily functions are changing and we're doing so much to our immune system and our GI system and every other system is usually not the best time to really embark upon a major dietary change. But we often try to integrate that closer to kind of finishing a course of chemotherapy or in more subtle ways in a more gradual fashion.
Great. All right, I'm gonna go ahead and click on, just so we did in the entrance of time, because get moving is actually closely related to body weight. Mm-hmm. So being physically active helps us become more metabolically healthy. And so there are recommendations to have about 150 minutes of moderate exercise a week or 75 minutes of more vigorous activity. And so the mindset behind that is for your metabolism, using having good blood glucose or blood sugar control, and then also keeping on some healthy muscle. So especially if you were to come in with some sort of major health diagnosis that is a tax on the body, you want as much muscle going into that as possible so that you can kind of weather the storm, if you will. Do you have any thoughts about this?
Well, it's so important, and that's one of the things that we do encourage our patients to embark on, even in a really slow and gradual way, to integrate that into their life even while they're on treatment. And I think you may be talking about this soon, but there are different types of exercise than what we might traditionally think about, like running, jogging, biking. Those are not the only forms of exercise. And this, so I certainly encourage my patients to start walking. It can be the easiest one to integrate into one's schedule. It's somewhat easier during nicer weather, but I think outside the box. There are any number of videos on YouTube, on DVD that are available at the library for free that you can have access to different forms of exercise. So don't limit yourself into thinking that one has to be a runner in order to get good exercise in.
Or that it needs to be painful.
Yeah,
it'd be fun. Eat your vegetables. Have you heard that maybe at some of the other sessions? Is this kind of a recurring theme? Do we sound like broken records? So, you know, as probably you've heard in some of the other sessions, if you have attended those, we recommend eating vegetables of various colors, and we'll be seeing some bright, colorful vegetables tonight. Thinking about getting foods that are higher in fiber, and vegetables are a good source of those, and then when you're making your plate, to fill 2/3 of your plate with vegetables. And the mentality behind this is phytochemicals, the colors that you find in those vegetables have some cancer-fighting properties to them. And also, vegetables are usually lower calorie. They fill you up because they take lots of space in your stomach and make you feel full. So any thoughts?
Yes, absolutely crucial. This does come up in my population a lot of the times because some of my patients who are embarking on chemotherapy do have a decreased immune system for some period of time. So we do try and modify some of the vegetables that they eat and some of the preparations that my patients need to use during those times. But even if someone has a really depressed immune system, even in the most immunologically vulnerable state, like a bone marrow transplant, vegetables are still possible and encouraged. And so we're with the help of our registered dietitians through the Cancer Center, we're able to find a way for patients to integrate it, even if they are immunologically compromised.
And I work with older guys that as we talk about vegetables and they turn up their noses all the time. Like, oh my goodness, let's just try some. So avoiding fast foods and processed foods. So trying to focus more on vegetables and fruits and things that aren't as calorically dense. And again, the idea behind this is that it's more of a lifestyle to help prevent weight gain as an adult. I'm going to go ahead and move on because that one's pretty related.
Self-evident, yeah.
Yeah. Less red and processed meat. This is not a popular message in the Midwest. I grew up on a cattle farm, so I get it. But the recommendation is to limit your red meat servings to 3 per week, and the portion sizes are 3 ounces or 4 ounces, so about the size of your palm or a deck of cards. And then processed meats are like your salted, cured foods, so avoiding those. And the reason behind this is that these foods are associated with colon cancer risk and also some other cancer types. Any thoughts here?
Yeah, so portion control is such an important part of that too, because I think the idea that you can have meat 3 times a week, some of my patients I know have said, well, since I can only have it 3 times a week, I'm really going to make it count, and I'm going to have that name your size T-bone, and that's not really what we're talking about. But the other thing that we do know that there is some data that eating charred meat particularly is at increased risk for certain cancers, stomach cancer, esophageal cancer particularly. So in any case, but just trying to be mindful of what a real portion really consists of, and trying to use non-charbroiled or char-grilled methods are some of the tips that I try to impart into my patients.
Great. Again, in thinking about healthy weight, trying to find beverages that don't have a lot of extra sugar in them. Again, that's really just the idea of avoiding, a lot of times when we drink sugary beverages, we don't feel very full. And so that's aiming for the food sources. Limit alcohol intake. So Kermie has had a little too much. And this is kind of a tricky message that maybe you will hear different things depending on who the special speaker is. In a cancer setting, alcohol intake is associated with increased risk. But from a heart disease perspective, moderate amount of alcohol could actually be somewhat protective in your older age. So it is kind of a tricky thing, but I don't know, do you have this conversation with patients sometimes?
I do. I mean, I think it's difficult. Most of the patients I see have some sort of opinion about the role of alcohol in their life. Some people can live without it. Some people think that it's an important part of them living a full life and a good quality of life. And so I try to meet people where they are, because I'm not the one living their life. But what I would say, portion control for this as well. We're not talking about a glass of wine, we're talking about a glass of wine. So I think that's the other thing, if we're trying to limit it to 7 drinks a week for women, 14 for men at most, no more than I think 4 and 3 in any given setting, respectively. We're talking about potentially a very different volume than what you might be served somewhere. So just be mindful of that.
Yeah. Supplements, dietary supplements. Oh, good, we have a question.
Vegetables.
Yes.
How do you feel about the use of organic produce?
So I wouldn't discourage anybody from using organic produce, but I also don't think that that it's absolutely critical for people to spend their dollar on it. We really want people to eat their vegetables. So I don't know.
I agree. I'll take whatever I can get. I think if that is an important part of the way that you fit into the planet, then I certainly support that. But the last thing I would want is for that label to be an impediment to getting in the fruits and vegetables. So,
absolutely.
Yeah.
So dietary supplements, unfortunately, there are several studies that have shown high-dose supplements can actually increase the risk of cancer. So beta-carotene, extra beta-carotene increases the risk of lung cancer in smokers. Really high-dose vitamin E and selenium are associated with increased risk of mortality. I mean, and do we really know exactly why? No. But we have enough information to say that more is not necessarily better. Just like when you take your medications, there's an optimal dose. Nutrients and vitamin minerals are very similar. So if you can think of it more like a Goldilocks, that we might need to correct some vitamins and minerals every now and then. So I don't want you to be scared of supplements, but I don't want you to think that high-dose vitamins and minerals are going to save you from cancer. So
and just please talk to your healthcare provider about them. We want to know what you're taking.
Yeah.
Even if we don't recommend it, it is really, really important as part of the healthcare plan for us just to know what it is that you're taking and what amount. So that would be the oncologist input.
Interact with medications.
They do,
as well.
yeah, they do.
So really thinking on the prevention side for the younger audience, so moms to breastfeed if they can, because that reduces the risk of breast cancer. Mm-hmm. And then after a diagnosis, so cancer survivors to follow all of those same guidelines. So they don't have any different guidelines for cancer survivors, really trying to maintain a healthy weight, and following those things. Any extra
Agreed.
comments about
Agreed.
that?
Make it a lifestyle.
Yeah. And we are about at time. Does anybody have any burning questions that they'd like to?
Yes,
Yeah.
go ahead.
Cutting out the sugary drinks. What are your opinions on the diet sodas?
Yeah, that's a great question. So
Repeat
the
it.
question was about artificial sweeteners. What are our opinions on diet sodas? So when we work with our cancer patients, we kind of talk about a good, better, best approach. So we think that a good first step, if people are drinking, let's say, heavy Coke, lots of Cokes all day, or Pepsi, let's give equal treatment to the brands. If they want to switch to diet soda, that will probably be a really quick way to reduce some calories in their intake. So I would consider that good. Going to better, we start looking at some of the artificial sweeteners that are, looking at the way that they're made, they're probably less damaging to some of the microbiome in your gut. So I don't know, have you guys heard about the microbiome in the gut, that healthy bugs in your gut are good, they're healthy? Well, there's some data that artificial sweeteners kind of mess up the flora in your gut. And so, so we kind of push people to ones that we think might not be as damaging. And then, so that's better. And then we go to best, which is really kind of going with plant-based drinks. So your teas, your coffees, waters, infused drinks. And we realize that not everybody is ready for that, and that's why we have this kind of spectrum.
Agree.
So what
But
do you?
if there is any fruit or sweet flavor that you like, there is a sparkling water for that now. So I think sparkling water can be a good middle ground for some of my patients.
Yeah.
You mentioned the artificial sweeteners. Which ones would you suggest?
Yeah, so a lot of times we have our patients kind of look more for the stevia types. It's a natural sweetener, and just try it and see. It sometimes has a little bit of a licorice flavor, so people aren't always keen on that.
Like equal or sweet and low?
And again, this isn't like there's data, but it's not super strong data, so I don't want to freak anybody out about artificial sweeteners. It's just, I think that it's an area of investigation, and from my standpoint, I just prefer to drink tea or coffee. So.
All right, I think we're going to go ahead and
Yep.
move on. But
Okay,
we'll
great.
have plenty more time for questions with our doctors
Okay,
at the
awesome.
end.
Thank
Great,
you.
Perfect. Thank you,
Thanks
guys.
for engaging,
Yes,
you
thank
guys.
you all
That
for
was
being
great.
here.
All right. Well, now I'm going to introduce Chef Aaron Prater to you. So Chef Prater has been an instructor here at JCCC for 9 years, and he's also a graduate of our program. So we're really excited to have him.
Yeah.
So thanks.
Thanks. So I'm going to make a couple different dishes. I'm going to try and squeeze it in the time that we've got. I don't like questions, so please be quiet while I cook. No, I'm just kidding. First, we're going to make a jerk sweet potato. I grew up in the South, and my mom made sweet potatoes all the time, but it was like butter and cinnamon and mashed potato or marshmallows on top, and I hate it. I still hate them. But my wife loves sweet potatoes, and so I tried to figure out a way to make this savory way that I would eat it. So this is sort of, and I also love Jamaican meat pies. I don't know if anybody's ever been to Jamaica or had like a meat pie. They're these little looks like a Hot Pocket, but it's full of like this spiced ground beef. Well, so I started basically playing with that flavor and did a sweet potato version. So that's what we're gonna do, and we're gonna serve it on a bun. So it's similar to like a pav bhaji, if anybody's familiar with Indian food. It's this sort of vegetarian potato, and it can have beans and stuff in it that you just put on a bun. So that's what we're gonna start with. So what I've got here is, that's about a sweet potato. I don't know, I cooked a bunch earlier and just took some out, but you can do this in scalable quantities, and I think we've got recipes for you. So these have just been boiled or simmered in some salted water because we don't want to boil anything. Boiling's like a really destructive process, and you're just gonna end up with these mushy potatoes. So we want to cook them till they're done, though. Cook them all the way through. So we're gonna take our sweet potatoes and put them in a bowl. And then the classic flavors of jerk are thyme, scallion, ginger, garlic, and normally you'd use a Scotch bonnet chili, which are kind of hard to find. So we're going to use a habanero, which is a close cousin. I'm going to use just a little bit because I'm from the South and Yankees don't really like spicy food, so we'll keep it down for you a little. But chop scallion, This is our fresh thyme. You can use dried thyme as well. Dried thyme and fresh thyme are very similar, but dried thyme's a little bit stronger, so you use a little bit less. Some lime zest, ginger, garlic, and then like just a tiny, tiny little bit of habanero. We're going to mash all this together, but the things that really give this, I think, the great flavor are the spices. So we're going to use some fresh nutmeg. I don't know if you've ever seen fresh nutmeg before, but it's these little nuts. And nutmeg goes bad really fast. So if you buy that powdered nutmeg and it's been in your closet or pantry for 3 Thanksgivings, get rid of it and do yourself a favor and get some fresh ones, right? So we'll just put a little nutmeg in here. And then my other favorite spice that's native to the New World is allspice. And it just looks like, almost like a little peppercorn, right? I'm going to grind some of these up. You can use a flat of the knife or a bottom of a pan. I've got all the toys here, so we'll do it this way. And just a pinch. This stuff's pretty strong. These have cooled a little bit, but while they're still hot, you want to mash some of it, so some of it's mashed and some of it's chunky, right? Little salt, little pepper. Another classic ingredient in jerk and a lot of recipes is mustard as well. I didn't put mustard in this because I wanted to put mustard on the bun for you to provide a little bit more acidity and brighten up the flavor so it wasn't too clumsy or heavy. I see some of you have some. Has anybody tried it? Do you like it? This is one of my favorite things to eat. I make this at home a lot for my wife and I. But I don't know if we can get a shot or if you can see this, but it's kind of ugly. But it tastes really good, right? And a lot of the best foods are. I spend all day trying to teach people to make food pretty, but I grew up eating red beans and rice, and that's about as ugly a dish as you can find. But it tastes the best. I did this because sweet potatoes they're good for you. Reducing that meat intake is good for you. The more we can find substitutes that we don't hate or we aren't afraid of, the easier this is. And this. I mean, you saw how long it took me to mix it together. Sure, you didn't see me chop everything earlier, but this whole thing can be put together in, the 20 minutes it takes to boil your potatoes, right? What do we think? Do we like it? Is it okay? Okay, good, because this one gets a mixed reaction sometimes. Mostly because everybody hears sweet potatoes and they expect marshmallows and cinnamon and butter and things like that. The next dish, though, and I'm sorry to rush you along, but I do want to get to some questions, and it's not fair to ask you questions while you're eating, right? So the next dish I'm going to take a little bit more time with, and we're going to cook. This is an Italian dish from Umbria, and so it's lenticchie umido, which is stewed lentils. And normally you'd use these famous lentils from Umbria called Castelluccio. We're going to use just your standard brown lentils that you'd find anywhere. They tend to get a little bit softer, so you don't want to overcook them because they'll get really mushy and just kind of fall apart. So the first thing we do is we're going to turn some water on here to boil when I figure out which one's the right one. And we'll start heating up our pan with a little bit of oil. I'm just using some olive oil. Classically, this recipe uses pancetta. Pancetta is pork belly that's been salted and cured and dried and rolled up, and it's delicious, but kind of anti what we're talking about today. So we're going to use just some nice olive oil. We're going to start with our carrots. Carrots are the longest, they're the hardest vegetable that we've got here, and so we're going to cook them a little bit longer so they soften first. Generally speaking, when you're cooking anything in layers like this, when you start building your flavors, every time you put something in the pan, you'd put just a little salt. I'm not talking like a heavy pinch, just a little bit to help draw out some of that moisture and help layer the flavors a little bit better. I love this dish because it's full of sage. I mean, it's just in your nose. Like, you're going to be surprised that there isn't meat in this dish because it kind of tastes like there's sausage in it almost. Then we go to our onions. Also, whenever anything says saute, You want to hear that sound. Sauté is an aggressive cooking method, right? And if we're not hearing that sound, we're not cooking the water away, and we don't get the depth of flavor that we're looking for. Then we'll add some celery. So this is our mirepoix. This is the standard collection of vegetables that form the base of everything in sort of classical French cuisine, but you see it all over the world as well. While those soften, I'm going to talk about our secret ingredient. Who's had Vegemite before? Yeah? It's good, isn't it? No? What is it? It's left over from the brewery, right? It's the yeast at the bottom of the barrel. And so what they do is they rinse it really good to get rid of all the bitterness, and then they cook it with these same vegetables and some garlic and some herbs, and they cook it down to this really gross brown paste. But the thing that it really does, we're just going to add our lentils now. The thing that it works for in this capacity is it's an umami bomb. Have you guys heard of umami? So umami is the fifth taste, right? So we all grew up with salty, sour, bitter, and sweet. But our tongue has other taste receptors, and that includes umami, and that's the Japanese word for it, but it's glutamates, right? So we get that flavor from meats, from the sort of jelly inside tomatoes, from mushrooms, comes out in soy sauce, right? MSG, which a lot of people are afraid of, is just monosodium glutamate. And it's actually got a big resurgence because chefs love it, and there's actually never been any conclusive evidence that it's what caused all those headaches from Chinese food. Could have been anything. While we're doing that, I wanted to coat the lentils in oil before I add garlic. Garlic cooks super fast, right? So I think in the recipe I said cook it for 30 seconds, maybe even 15 seconds. Once your garlic starts turning brown, it starts turning bitter, and that bitterness doesn't go away, and it's just going to kind of ruin your dish, I think. So we'll add a little garlic now. But anyway, back to umami. We use umami to balance out all of our flavors, right? If you think like the salty, sour, bittersweet is a Venn diagram, right? We want everything to overlap so it comes cohesively together and tastes nice. If you're not using meat, it's kind of hard to do. If you're not using aged cheese, has a lot of it, so Parmesan's a big one. But if you're not using those ingredients and you don't want that cheese flavor, they sell these things like liquid aminos, or I think there's a big yeast extract, like powdered yeast extract, that you can add to kind of add that umami character. But Vegemite and Marmite, which is the New Zealand counterpart, Vegemite's the Australian one, are huge in umami. They're pretty much umami bombs. They're salty and they're gross by themselves. I don't understand how the Australians eat it. They literally just spread it on buttered bread, and it's the worst thing. I was stationed in Australia and we were painting this church, and they brought us all these sandwiches, and we were starving, and we just started eating them, and oh man, it was like pretty much, there was 20 Marines puking on the side of a church we just painted because it was the worst thing we'd ever eaten. I know I'm really selling it here, right? But in the case of this, it's going to add a richness and a depth of flavor that you're not going to get unless you add meat or you add some of those other ingredients that we're not going to put into this dish. So I'm just going to put, I don't know, this is maybe a teaspoon, along with the sage that I just added. And I'll pass this around if somebody wants to smell it, because it's gross. One of the things I love about lentils is how quickly they cook. This dish, all told, once you put it in the pot and start cooking, it's only going to take about 20 minutes. Now, the classic recipe says to take boiling water and pour it over, so that's why this water's hot. At home, normally I would just fill it up with cold water and bring it to a simmer. You also don't want to stir them too much, because once it gets going, once these lentils start cooking, the more you stir it, the more they're going to break down. And you're going to have this sort of, I mean, it's already kind of mushy, right? But if we stirred it a lot, it would be almost like a paste, which still tastes good. It's just a little bit uglier in the bowl. And we want to get that Vegemite mixed in really good. Clean our spoon. All right, now that you've got your mouths full, questions? No? So I love beans. I grew up on beans, all forms of beans. I think they're fantastic. And this is one of my favorite things in the world over some brown rice or just by itself even. I think it's just a really filling and a really nice side component or just a meal by itself. It doesn't need much else. And it's full of all these good vegetables that we're talking about. You saw very little fat in here. So this is just, I mean, for a guy that works with like bacon and cream all day long, you know, this is about as healthy as we're going to get, you know, out of my kitchen anyway. So once our stuff comes to a simmer, add a little bit more liquid because you don't want to, it's not like rice where we're afraid to open the lid, but we don't want to open it too much. We'll turn it down to a simmer, and then in 20 minutes, we're ready to go. How was it? Yeah? You guys are way too quiet. This worked. Oh, yeah. Please. So World Market's a good place to get it. World Market always has it. I've seen it at a few other stores, but a lot of times it's seasonal because I don't know what season Vegemite it's in, but, you know, like you can't find it all the time. But World Market usually carries it, or you can buy it online pretty easily.
And did you suggest that you could use liquid aminos instead of the vegetables?
You could, absolutely. I just want to add something that's going to give that umami character. Like if you really wanted to cheat, you could do some Parmesan cheese. You could add soy sauce, which has a lot of that umami character as well, but then you're going to change the flavor of the dish quite a bit. Other questions? This works a lot better when you talk. No? Oh. Oh, they're up in the front table, yeah. And then I think you had your hand up.
I was just curious, does it work as well if you use larger chunks of vegetables?
It will, absolutely. This dish, the classic version of it, the vegetables are meant to kind of cook away and become really soft, but you could leave large chunks. You could add different vegetables to it, like you could put some zucchini in here, or even some cabbage might be nice in it, or mushrooms would be great. So it's a pretty versatile dish.
Because it has a very stew-like taste to me, and I was thinking that something with some larger vegetables in it and stuff.
Yeah, absolutely. You absolutely could do that. Yeah. You could definitely, yeah, you definitely could use a broth. A meat-based broth would have that umami in it, and it would give you some of that flavor. A lot of times, I don't like to use broth when I'm cooking beans, though, because it takes the beans longer to cook because there's already a bunch of dissolved stuff in the liquid, so it can't penetrate into the bean as well. So clean, fresh water helps your beans cook a little bit better. Yeah? So it would freeze beautifully. So you could freeze it really well. Generally, from a food safety standpoint, we don't want you to keep food longer than a week. 7 days is kind of the top end of that. But if you were to make a big batch and put some in a quart container and freeze it, it'd hold really, really well. How are we doing on time? We good? Other questions? Otherwise, I'm going to give you back to the doctors. I give them food, right?
Okay. Well, thank you everyone for coming. We hope you enjoyed this presentation, got to try some of the good food. We're really looking forward to next month's presentation. Is going to be about brain health. And then in December, we're going to actually be tackling healthy baking. So that should be fun as well. So we look forward to seeing you guys again. Thank you.